Opioid and alcohol abuse are serious problems in the United States. People start using for many reasons: social pressure, trauma, socioeconomic factors, or medical causes like surgery. Understanding these factors helps counselors, families, and clinicians better prevent and treat addiction. Traditional treatments like counseling and therapy are often not sufficient. Other modes of treatment include drugs or medications such as Suboxone or methadone. These medications help, but they don't fully block the opioid receptors, so patients can still feel the effects of substances and stay dependent. Vivitrol is a newer option. It's an extended release injectable form of naltrexone. It's used to treat opioid use disorder and alcohol use disorder. Vivitrol is a non-habit forming opioid antagonist that completely blocks the mu opioid receptors for about 28 days per injection. It prevents opioids from producing their euphoric effects. This reduces the desire to use, but it doesn't fully eliminate cravings, so counseling remains very important. For alcohol, Vivitrol affects the brain's reward system, especially the dopamine pathways, reducing the reinforcing effects of drinking. Side effects are always a possibility with any drug. Two of the most concerning side effects with Vivitrol. One is going to be the risk of opioid overdose due to its receptor blocking ability, and two, it's going to be sudden opioid withdrawal. Patients must be fully detoxed from opioids 7 to 10 days and alcohol 3 to 7 days before they can start Vivitrol to avoid dangerous withdrawal. This requirement and limited awareness can make access difficult. It is imperative to speak transparently and in depth with a doctor prior to receiving Vivitrol. To give you a visual example of how Vivitrol works, I have 3 components. I have a lock, I have keys, and I have a blocking mechanism. Many times I have heard the phrase, "What is the key that fits your lock?" Meaning what substance is your preferred drug that makes you feel euphoric and want to continue using. Everyone has a key that fits their lock. Once that key is found, it creates the potential of addiction for the user. So looking at our props, the lock will represent the mu opioid receptor in our brains. The keys will represent opioids and alcohol. The lid will represent naltrexone from the Vivitrol injection. So the way that this works, once the injection is made into the gluteal muscle, naltrexone makes its way to the brain through the circulatory system, reaching the mu opioid receptor. It binds and it blocks opioids and alcohol from being able to bind to that receptor, which would normally cause the high or euphoric feeling from the substance. This stops the reward for the user. Let's focus a moment on a population of people where there are large numbers of addicts. While drug users and alcoholics are not always criminals, addiction rates and drug-related offenses are soaring. Within our jail and prison systems, about 85% of people have substance use disorders or they are there for drug-related crimes. Common offenses include drug possession, theft, and assault, which is more prevalent with alcohol when it's involved. Despite this, fewer than 15% receive evidence-based treatment while incarcerated. Due to the lack of treatment, there are high rates of relapse and recidivism. It's up to about 75% for untreated addiction, which keeps many cycling through jails, hospitals, and courts. This costs taxpayers between $250,000 and $500,000 per person over a 10-year period. This includes incarceration, medical emergencies, and legal costs. More importantly, this individual is in a constant battle of addiction, further making it nearly impossible to get off the hopeless merry-go-round. Many times, a hopeless addict equates to a worsening addict, continuing the circle of untreated addiction cost. While prevention is always the goal, it is impossible to completely prevent all of it, so we must look at treatment options as the alternative. Effective treatment can combine medication-assisted treatment like Vivitrol with counseling, social support from family and friends, long-term follow-up care, all of the above. Many addicts have lived through things that most of us could never imagine. Many are hurt and they are broken. They've been through a lot. By reducing the stigma, looking at the person as a human, not a problem or someone who needs to be punished, realizing this is someone's family member and thinking, what if this were my loved one? This adds a more empathetic approach and an understanding that some people refuse to adopt. But without love and compassion for the whole person, not the addiction, it is impossible to help in a meaningful way. Prevention efforts focus on education and early intervention. To reduce initiation of substance use, early intervention in elementary schools, continuing prevention education throughout childhood and young adulthood is imperative to preventing substance use. Children who are taught coping strategies, provided with safe and loving places, whether it be with school, family, religious entities, or they're being part of extracurricular activities and groups, can reiterate positivity, making it less likely for aging adolescents to turn to drugs. Ways to finance this potential recovery mode could include expanding access to Vivitrol, counseling, and therapy for both incarcerated individuals and the general population. It may seem costly up front, but it can be financed through a combination of reallocating existing correctional funds, federal grants, and state-level public health initiatives. Currently, there are billions that are spent on repeated incarceration and emergency care for untreated addiction. Redirecting a portion of that funding toward evidence-based treatment can lower recidivism, reduce healthcare burdens, and improve long-term public safety. Additional support can come from Substance Abuse and Mental Health Services Administration, Medicaid expansion, especially post-release from jail or prison, and partnerships with nonprofits and behavioral health organizations. An out-of-the-box option may be offering tax incentives for medical professionals who volunteer their addiction treatment expertise to inmates. It may help offset initial costs while lowering the recidivism rate. Investing in treatment over punishment is not only more humane, it's economically smarter, saving taxpayers money while giving people a real chance at recovery. Expanding access to Vivitrol and other evidence-based treatments in correctional settings can reduce relapse, recidivism, and overdose deaths, saving money, producing more economically productive citizens, and improving public health. Instead of continuing the addiction stigma, let's focus our efforts in what we as individuals can do by asking, who can I contact to respectfully voice my concern regarding prevention and treatment? State representatives, the Attorney General, the Governor, maybe all of them. How can I help? What can I contribute to making a difference in the world of addiction? All of these are valid questions that we need to look within. More voices together can make a bigger impact on our communities, but it starts with a solid foundational understanding of the challenges and the shortfalls that currently exist. But we also need an obtainable plan of action to help aid in the solution. The goal is to prevent the cycle of addiction, but if we can't prevent it, let's focus on evidence-based treatment tools for treatment. Collectively, we can make a difference on both ends of the addiction prevention and treatment spectrum.